Okay, here we are with Heather, and Heather's been a patient in our office for a couple of months. And Heather, can you share some of the challenges that were going on with you and why you wanted to come to our office? What were your problems?
Well, I had a lot of digestive issues. I had problems sleeping. I had depression, was taking medication for that, high blood pressure, a lot of different things.
And I think you also mentioned that you not only did you have some mood challenges, but you felt like you couldn't. Your memory was suffering. You weren't able to focus as well.
Yes.
And also, I think we had some pretty significant fatigue issues. Is that right?
Yeah, I was tired all the time, and I didn't have any drive to actually do much of anything.
Okay. All right. And I think we mentioned the high blood pressure. I think you mentioned that, and also we had you had constant low back pain. Is that correct? Okay, so that was bothering you constantly. Okay. And as a result of these problems that you were having, and you had kind of an IBS issues where your bowels were kind of unregulated and bloating and things like that. And as a result of these problems, like how was it getting in the way of your life?
Well, I didn't want to go out and do things. I really like to be home.
Just want to stay home. Yeah. Okay. That's a problem if you need to work, right?
Yeah, and it just made life in general very difficult and not that enjoyable.
I think you told me that you had to force yourself to do everything, right?
Yeah.
That's not fun. Okay. And the result of being a patient in our office, how are things better?
Things are quite a bit better. I'm sleeping a lot better at night, which is wonderful. Due to a mix-up with my mail-order prescriptions. I was without prescriptions for a while, and then when I tried to start taking them again, I was getting lightheaded and dizzy, so I went in and saw the doctor, so I'm not taking my blood pressure medication anymore or my antidepressant
right,
anymore.
Right, because the moods are better and your blood pressure, we've seen a drop in your blood pressure.
Yeah.
So those are major wins. And as a result of the digestion's doing a lot better, right?
A lot.
And the energy's a lot better. Good. And as a result of those improvements, how is it making life easier, more enjoyable for you?
There's actually things that I want to and do, and just made life a lot more enjoyable.
Take care of your kids, your spouse, your husband, and do your job better. It's all more enjoyable. Okay, wonderful. Now, Heather, if you knew someone who was having chronic health conditions, would you refer them to our office?
Yes, I would.
Good. And I know we're talking about some family members that maybe we can get in the office. I really appreciate your support and being such a good patient too. All right, thanks so much.